Hello everyone and welcome to our live lesson for today. Just while we're waiting for other people to join us, please come into the chat and say hello. I can see some of you are doing this already, which is great. Come in and say hello and tell us whereabouts you're joining us from and how far along you are in your OET preparation. So I'm here, I can say hello from the UK where it's surprisingly sunny today, which is lovely. Okay, great. Okay, great. So I can see a few of you are joining us from the UK as well, which is lovely. And we have quite a lot of you from all over the world. Great. Okay. Wow. Okay, great. So we have really, wow, we've got really people from all over today, which is very exciting. Okay. So let's make a start with our session today. So hello everyone. My name is Bethan Edwards and I'm the Academic Director here at Specialist Language Courses. And today we're going to cover how to select relevant information from the case notes in OET Writing. So before starting, just a few tips for our session today. If you are new to our live lessons, first of all, our lesson is being recorded. So feel free to take notes or screenshots, but know that we will be sharing this via our YouTube channel. So don't forget to subscribe to our YouTube channel where you can find lots of tips and videos and ideas on passing your OET. Second, I'm going to be a little bit about how we're using Zoom today. So we're going to use the chat like you've been doing already. We're going to use the chat to complete tasks during the class today. We may use some polls. In order to answer any poll questions, click on the answer that you want and then click submit. And then we also have the question and answer function. So if you have any questions throughout the session, you can put them in here and then I'll do my best to answer them at the end of the session. And then we'll also have time for questions and answers at the end as well. Third, don't forget to register for our next free live lesson, which is on Thursday. We'll be talking about reading C and looking at tips and strategies. The link will be available in the chat box for you now. Okay, so let's get started. So today we are going to talk about selecting relevant information for your letter in the OET exam. We're going to cover some tips on analysing the case notes, how you can select relevant information and some tools in order to help you do this. And we'll look at tools and then we'll also do some practice where I will be asking you to look at some extracts from case notes and decide, do you think it's relevant or irrelevant information for a particular writing task? So what is important when you are selecting information and analysing the case notes? So as with other papers in OET, it's advisable to have a clear strategy and some steps to follow so that when you come to the exam day, you know what to expect, and this can help to lower any exam day nerves that you might have. So in terms of steps for analysing the case notes, you should, as step one, when you look at the case notes, you should look at the case notes to find out who you are writing to and why. Then step two, you need to decide what information is relevant and what information the reader does not need to know. So these are two very important steps in writing your letter during the exam. And this is because selecting relevant information is assessed by OET in terms of content. So for your OET letter, in order to get full marks, you need to choose the most relevant content for the letter and the reader. And you're also assessed on conciseness and clarity. So this is your ability to summarize information effectively for the reader and present it in a clear way. So you need to make sure that the details that you provide and the information you provide in the letter is relevant to the reader and relevant to the purpose of the letter. If you include a lot of details which are not important to the reader, then you may lose marks on conciseness and clarity. So in your OET exam, you have 5 minutes reading time before you start writing. So within those 5 minutes reading time, you need to have a plan of what you're going to do when you're looking at the case notes. So the first thing you need to ask yourself when you look at case notes is, who is the reader? And what is the reason for writing? You can find this information in the notes at the top and in the writing task at the end of the case notes. So we have an example of a writing task on the screen. So I'd like you to take a few seconds just to read through the information, and then we're going to answer these questions. So from the writing task, we can see that our reader, the person who's going to read your letter, is Ms. Emma Humphrey, and she is the nurse at Somerton Retirement Home. The reason for writing is to inform her of the current situation and the care required. So this current situation and care required is the main focus of the letter. So this is the first thing that you should do when you, within your 5 minutes reading time, answer these questions. Who is the reader and what is the reason for writing? Once you've got this information, this then helps you to decide what information and content from the case notes you need to include. Something else that is important to mention here is there is an existing relationship between Ms. Emma Humphrey, the reader, and the patient, Mr. Smith. So we can see that Mr. Smith lives in the retirement home, so Ms. Emma Humphrey already knows him. So this influences what information we choose to include in the letter, as there may be information that Ms. Emma Humphrey already knows. So when you are analysing the case notes, you always need to have these two questions in your mind when you're deciding what information you should choose. So we've got the purpose, we've looked at the writing task, we know the purpose to inform of the current situation and the care required. So we can look at this extract from the case notes and we ask ourselves, does the reader need to know this information? And does the reader already know this information? So these two questions are vital when you're deciding what information to include. So let's have a look at what on the screen is relevant and irrelevant and why. So we're going to do this one. I'm going to show you this one and then I'm going to ask you to answer some questions. So we can see we've got our purpose. We're constantly reminding ourselves of our purpose. We can see that this information is relevant. This is information that you should include in your letter. That the treatment that he's had is a total right hip replacement. We also need to know the admission date, and we would also need to briefly describe the diagnosis. But then when we look at the past medical history, we can see that we can assume that the reader probably already knows about his hypertension. Remember that she's the nurse in his retirement home, so she already knows this, therefore you don't need to include it. And in terms of his past medical history, you wouldn't include this information, because remember, our purpose is to inform of the current situation and care required. So his past medical history here would not be included in your letter. So how do you select the relevant information? When you are deciding what is relevant and irrelevant, you really need to think about what is essential information, what is essential for the ongoing care of this patient and the main purpose, and what is irrelevant. So what information is already known or what information is not needed. In order to decide on this information, you can ask yourself some guiding questions, and we're going to use these guiding questions today when we're looking at some extracts from case notes. So ask yourself, who are you? So who am I? Who are you writing as? And who are you writing to? Why am I writing? So here we want to know the overall purpose of the letter. For example, it may be to request ongoing care, or as we've just seen, to inform of the current situation. What is the key information to include? Now, it's really important that you keep in mind the overall purpose, so that every piece of information that you choose to include is relevant to the purpose. It supports the purpose and enables the reader to do what you're asking them to. What information is not relevant to the purpose of this letter for this reader? So in other situations outside of OET, it may be a requirement that you always include a full past medical history, or you always include specific pieces of information. But remember that in OET, what they're looking for is to see if you can include the information relevant to this letter for this reader in this situation. So we are going to look at some extracts from case notes today, and we are going to focus on writing to another healthcare professional. So we're going to look particularly at a referral to a physiotherapist. So there are a couple of things to bear in mind when we are writing to another healthcare professional, a physiotherapist. So for a physiotherapist, you may need to include brief details of any accidents or operations, but you must make sure that these details link to the reason why the physiotherapy is needed. So you may not need to write full details of all of the treatment that was given to the patient before the operation or perhaps after the operation. You need to make sure that you may need to include information relating to mobility or range of motion, any occupational therapy interventions that may have been given, and any information relating to previous physiotherapy sessions. So for example, if it's in-hospital treatment, perhaps the patient has already received some physiotherapy sessions, and any physiotherapy sessions that are needed and that are either already arranged or are going to be requested. So let's look at some extracts from the case notes. So on the screen, you can see some notes and you can see a writing task. And I'd like you to ask yourself and answer these two questions in the chat. So question number 1, who are you and who are you writing to? And question number 2 is why. So this is what is the main purpose. So please write your answers into the chat using numbers 1 and 2 to show us which your answers are. Okay, so make sure you put your answers into the chat. Okay, great. So a lot of you are getting that and writing in the chat. Okay, good. So let's have a look at our answers. So who are you? You are the charge nurse at Shippington Community Hospital. So this is who you are. You're writing as a charge nurse. And you're writing to the community physiotherapist, who is called Mr. Tim Jenkins. Great. And why? So this is the purpose of your letter. You are writing to request physiotherapy home visits. So at the moment, we're not sure why the patient was admitted. We've got the patient was admitted after a fall. So we've got this information. So we know why he was admitted, but we need to look at the case notes to get a little bit more information to know what we need to select. So let's have a look at our next guiding questions. So we've got some more extracts from the case notes here, and we're going to ask ourselves and answer these questions. What is the key information to include? And what information is not relevant to the purpose of the letter? So we've got a little reminder here that our main purpose of the letter is to request physiotherapy home visits. So while you're looking at these case notes, you need to ask yourself these questions. You need to be thinking of these questions. Does the reader need to know this? Or does the reader already know this? And we're going to think about these questions and also the purpose to decide what is relevant. So information that is essential or useful, and what information is irrelevant or what information is not needed. So let's take this section by section. So look at the screen here and decide, is this relevant or irrelevant? Put your answers into the chat. Excellent, everybody's unanimous. It is relevant. Yes, you are right. So it is essential that you include the patient details, so the name, date of birth or age, the admission date, and the diagnosis. This is essential information for the reader of this letter. Okay, so let's look at the next section. How about his social history? Lives with his wife, 3 children who live nearby, and owns a delivery company. Remember that the purpose of your letter is to request physiotherapy home visits after a fractured right knee. So is this information relevant or irrelevant? Okay, so we've got a mixture here. So quite a lot of you are saying irrelevant. And a few of you have pointed out that he lives with his wife, that could be relevant. So we have got the majority of this information down as not relevant. However, you're right to point out that living with his wife could be relevant because the physiotherapist needs to make home visits. So what you would need to do is to look at the rest of the case notes and check to see if the fact that he lives with his wife is important. Does she have any conditions that the physiotherapist should be aware of before the home visits are arranged, or will she be providing care for him? So here you would make a judgment. So lives with wife could be useful, but in general here, his social history is not so important to this letter. What about past medical history? Okay, so we're getting some of you say it's relevant, some of you say it's not relevant, and we've got a nice answer. I like here. It depends. Okay, so we need to bear in mind the main purpose of our letter. The main purpose of our letter is to request remember, we're writing to a physiotherapist. So we're writing to a physiotherapist and we're requesting home visits after a fractured right knee. So we need to see if any of this past medical history is important for the physiotherapist to know in order to carry out those home visits. So we look at what is in this past medical history. Here we've got high cholesterol and we've got angioplasty. So we can assume that this information is not relevant to his recovery from a fractured right knee. Now, if we had other information in here about perhaps a previous fracture or a previous injury to his right knee, then it could be relevant. But in general, you need to be quite ruthless with your past medical history and with choosing what information the reader needs to know, because you only have 200 words. So it's really important that you decide, is this completely relevant for this reader for this letter in order to provide care, or is it something that this reader may not need to know? So in this case, unless there is anything else in the case notes that suggests that we need to tell the physiotherapist, this would not be included in your letter. So we are going to have a look at some more extracts from the case notes. So I am going to talk you through some specific elements of these extracts. So take a few seconds to look at the information on the screen and ask yourself these key questions. What is the key information to include that's relevant to our letter, and what is not relevant to the purpose? Here is a reminder of the purpose. So you don't need to write in the chat box, but just take a few seconds to look through and read this information. Okay, so looking at this information, which is on hospital treatment, some information that we definitely need to include is details of the surgery. So we know that he had a fractured right knee, and we find out here that this was the treatment for his fractured right knee. He had surgery. However, the details prior to the surgery, the details of what happened on admission is not relevant to this letter. Remember, we're writing to the physiotherapist for home visits after he is discharged from hospital. So these details of specifically what happened on admission and before the surgery happened do not need to be included in your letter. And the wound monitoring and the analgesic for pain, again, this is relating specifically to what happened after the surgery and is not necessary to include for a letter to a physiotherapist. The main piece of information we need here is the surgery that he underwent. Looking at the case notes, you can see that there are details of physio that was given to him in the hospital. Now, where you have multiple sessions, it's very important that you summarize effectively. So you want to avoid writing each of the sessions, individually. So rather than this, you should summarize and you should focus on the current session. So you might say, or the current situation, you might say that currently his range of movement is 3 out of 5 power, or you might say, you might describe the progression from 1 to 3. But what you need to avoid is writing on the 22nd, his range of movement was, on the 23rd, his range of movement was, etc. It's very important to summarize. Similarly, with the information on mobility, you should focus on the current situation rather than describing what happened in a chronological way. So you would avoid saying on the 23rd, he was able to mobilize with one person, but on the 24th, he was able to mobilize independently. You focus on the current situation. So where you have hospital treatment information, it's very important that you look for patterns, for example, hospital physio, and you decide how to summarize that information. Okay, so our top tips for selecting relevant information in your OET letters. Make sure that you look at the writing task and the notes first. Make sure you find out who the reader is and who you are as well. Check to see if there are any existing relationships, as this will have an influence on what information you choose to include in your letter. Be clear about the care required by the reader. So make sure you understand what it is that the reader needs to do, because this will then help you to decide what information you need to give them. And also think about, constantly have this, what is the overall main purpose of my letter when you are analysing the case notes? You need to keep coming back to this to make sure that all of the details you've chosen are relevant. Okay. Great. So it is time for questions. So please use the question and answer function to ask me any questions, and I will do my best to answer them in the next few minutes. Okay, so you should be able to see the question and answer, section. So our first question is, where is the link for the next Zoom? It's coming up, so we'll pop that into the chat box shortly. Okay. Okay. So we have one question. Is it possible for us to write on the writing booklet? So in the paper-based exam, you have the case notes and you have an answer booklet. You must write your answer in the answer booklet, as this is the one that the examiners will look at. You have lined pages to write your answer and blank pages to make notes. You can write on the case notes as well, but only after the 5-minute reading time. During the 5-minute reading time, you cannot write anything. But the only part that the assessor will look at is your answer in the answer booklet. Okay. Okay, so another question is, when do we have to describe the full recovery of the patient? It depends on the case notes, it depends on the case, and it depends on the person you're writing to and the reason that you're writing. So if you are writing a hospital discharge letter, for example, you may need to summarize the treatment in hospital, focusing on the ongoing care requests that you are asking for. If you are writing in OET medicine and you're writing as a GP to request perhaps a referral to a specialist, then you would need to choose the information from the patient records relevant to this particular case. Okay, we have a good question here. If you write your request in the introduction, do you have to write it again in the conclusion? So again at the end? The answer is yes, it's a good idea to do this. So in order to get 3 out of 3 for the purpose of your letter, you need to make sure that the purpose of the letter is sufficiently expanded. So this means that you make the purpose of the letter clear in the first paragraph. It needs to be immediately clear in the first paragraph, and then the purpose of the letter needs to be clear throughout the letter. So you may find, depending on how you organize your letter, you have requests throughout the letter, and then it's a good idea to reiterate that request at the end of your letter, but be careful that you don't repeat exactly the same words. Try to paraphrase. Okay. Okay. So we have a good question here. Is there any recommended template when writing a letter? The answer is there are different ways to structure your letter. So there are different ways, recommended structures, but templates, no. It's very important that you don't use a template and write the same thing for each letter. If the OET assessors are looking at this, then it's very important that you are writing to this particular reader and you are writing about this particular case. So there are phrases that you can use for letter writing, which means, so phrases that occur regularly. So you can use phrases for starting your letter and phrases for ending the letter, but you need to decide on the organizational structure of your letter. Quite often we look at chronological or thematical, but templates, please make sure that you avoid them. Okay. Okay, and we just have time for one more question, which is a question about OET at home. So OET at home, the question is there any place to write a quick plan or notes in the writing section? The answer is yes. There will be space for you to write some notes. And if you look through the guidance and the videos that are provided by OET, you'll be able to find this information. One thing that's important to mention is you cannot have any paper. So you can't make your notes on paper during OET at home because you have to make sure everything is done online. But yes, there is space to make notes in OET at home. Okay. So thank you everyone for your questions and thank you for coming along today. It has been great having you here. Don't forget to register for our next free live lesson, which is on Thursday. The link will be in the chat for you now. If you really liked this live lesson, please know that we're going to be doing them weekly. So please stay tuned to all of our social media platforms where we will be announcing these weekly live lessons. You can find the links to our social media platforms in the chat now. If you are preparing for your OET, then we have the perfect course for you. We have Reach OETB Nursing and Reach OETB Medicine. So these are online courses designed to help you to get to know the OET exam, get to know the format, expand your vocabulary and grammar that you need to use for the OET exam. And it also gives you lots of useful exam practice. We also have an OET practice test available. So this is a great option for you if you have got the exam coming up and you want to practice your timing and applying your strategies. And we also have the OET Writing Correction Service. So if you want some feedback specifically on your writing, you can, we'll send you some case notes, you can send us your letter, and then you receive feedback on it. If you have any questions, please don't hesitate to contact us on inquiries@specialistlanguagecourses.com or go to specialistlanguagecourses.com and contact us via the chat function there. Okay, that's it for me. Have a lovely day and thank you for coming.